I would like to thank Matron Hind, the Director of Nursing, Kuwait Center for Mental Health, to give me this opportunity to do this documentary. Also, big thanks for all the wards from head nurses and staff for their cooperation. Special thanks for my colleagues Matron Ghadir and Mr. Ahmed Nawar, and also big thanks for Mr. Christopher, who completed and helped to complete this movie, that without him we couldn't finalize it. Thank you all.
الأخوة والأخوات الزملاء الكرام، السلام عليكم ورحمة الله وبركاته. يسرني ويثلج صدري بصفتي فرد من فريق عمل مركز الكويت للصحة النفسية ورئيسة الهيئة التمريضية، أتقدم بهذا الإصدار لتوثيق جهود الأفراد العاملين بالمركز في مواجهة جائحة كورونا، والذي كنا فيه جميعا كمثل جندي واحد لا يتوانى عن تقديم كل إمكانياته لتكوين حائط صد منيع لإيقاف هذا الوباء ودرءه عن أبنائنا المرضى والعاملين على حد سواء. وعليه أتقدم بجزيل شكري وامتناني لكل أبنائي وزملائي من أفراد الهيئة التمريضية والأطباء، وعلى رأسهم رئيس القسم ورؤساء الأقسام الأخرى، وبالأخص الدكتورة خلود مديرة المركز لتوفيرها كل الإمكانيات لنا. وأتقدم بخالص شكري وامتنائي لفريق العمل الذي عمل جاهدا ليل نهارا لإنجاح هذا الإصدار، وهم الأخت غدير بندر والأخت مريم عباس والأخ أحمد نوار والأخ كريستوفر. أتمنى الصحة والسلامة للجميع، وحفظ الله الكويت وأهلها من كل مكروه. السلام عليكم ورحمة الله وبركاته.
السلام عليكم. معكم دكتور حماد عبد العال، مسؤول فريق الكوفيد بمركز الكويت للصحة النفسية. تم تشكيل الفريق في أول مارس 2020 عقب صدور القرار الوزاري بتشكيل فرق الكوفيد بالمستشفيات العامة، وشرفت بتكليفي من قبل رئيس القسم الطبي دكتور عمار الصايغ، ومن قبل مديرية المركز الدكتورة خلود العلي، وطبعا الأخوة في الهيئة التمريضية برئاسة مترون هند، وجميع الأخوة في الهيئة التمريضية. بالنسبة للتحديث الأخير كان بتاريخ 1/7/2020 تم تنسيق آلية الدخول كالآتي: أي حالة دخول للمركز بيتم عن طريق قسم الطوارئ، بيتم عمل ترياج في مدخل الطوارئ، وإذا المريض ما كانش عنده يعني أي أعراض أو مخالط لحالات إيجابية بيتم دخوله في مسار معين، وإذا كان المريض مخالط لحالة إيجابية أو عنده أعراض بيأخذ مسار الكوفيد. في الحالات المشتبهة بيتم دخولها مباشرة إلى أجنحة الكوفيد. عندنا جناح 44 للرجال، جناح 45 للنساء، وبيتم التعامل مع الحالات بأخذ المساحات وإرسال التحليل المختبر. بالنسبة للحالات غير المشتبهة والتي ليس لديها أعراض، فمنذ التحديث أو القرار الوزاري الأخير في 1/7 تم إنشاء منطقتي انتقالية أو أجنحة ترانزيشن، بيتم دخول المرضى اللي هم ليس لديهم أعراض وليس لديهم تاريخ مخالطة لتلك الأجنحة، ويتم أخذ مساحات لهم، وانتظار ظهور المسحة بيتم إعادة توزيع الحالات. إذا كانت إيجابية بيتم صعودها إلى أجنحة الكوفيد، أو إذا كانوا سلبيين فبيتم توزيعهم إلى الأجنحة المخصصة حسب منطقة السكن. أنتهز الفرصة أوجه الشكر لجميع الزملاء بالفريق، بدءا من الدكتورة خلود العلي مديرة المركز بدعمها المستمر للفريق واتباع سياسة الباب المفتوح في التعامل مع الأمور، والدكتور عمار الصايغ بتواجده الدائم معنا ومشاركته الفعالة وبدعمه اللامحدود للفريق. وطبعا الإخوة في الهيئة التمريضية اللي هم يعني نقدر أنهم يتحملوا العبء الأكبر في رعاية الحالات خلال الفترة الماضية. نتمنى أن ربنا يتم علينا الأمور على خير، ولكم ألف شكر.
Good morning. Thank you very much for giving me this opportunity to have a talk on the COVID team that was undertaken under the leadership of the director of the hospital, our nursing director, and the COVID team as a whole. It was a great opportunity for me to serve our patients and the staff during this pandemic. The whole world is infected and affected by this pandemic of corona. This is not just an issue, but it's a global issue. So here we started our COVID team under the leadership of Dr. Hamad, who trained us in nasopharyngeal swabbing in ward number 15. We did a mass swabbing in ward number 15. I cannot give you the exact numbers as such, but we were trained, and then we took over as a team to ward number 16. Also, we completed the whole patients and the staff because the outbreak was first in ward number 15, then it spread to ward number 16. So it was a great opportunity for me to serve our patients and the staff, and it was shifted to other wards as well as in the acute male wards like ward number 39, 40 and 41. All the wards, there were sporadic spread of corona. I cannot give you the exact numbers, but it was a real issue for our. Under the administrators, the umbrella, we worked with great effort and dedication. We got rid of this pandemic in our hospital. Okay, we got a really very good experience in this situation. It was a real emergency. Okay, we fought as a one good team. Our COVID team has about 11 people trained to do the swab anytime. 24/7 we used to attend these issues. So it was a great opportunity, and thank you very much for giving me this opportunity for me to tell a few words, and thank you very much for our matron also.
as a staff nurse in Ward 15. Here, actually, first patient had COVID, and we done a COVID test also. In that, she was positive. In that symptoms, she had fever, body pain, and other medical problem also. Immediately, we shifted her to Ward 45 because it's a corona ward. Staffs also had corona positive. After 1 week back on 11/5/2020, she has fever, body pain, breathing difficulty like that, and three more staffs also. Altogether, they just quarantined for 14 days in their home itself. After the 14 days, we checked COVID, it was negative. Then they joined a duty also. And our staffs are using PPE. We used gloves, mask, face shield, gown, and we maintained social distance and proper hand hygiene. Now we are free from COVID, and what we are telling this: be safe and stay at home.
Good morning, myself Arun Shampilip, a staff nurse working in casualty department, KCMH. We have a special desk and we arranged in the triage area to check the temperature of the patient, all the patients who are coming to seek services in casualty, followed by a checklist of whether the patient has any travel history or any contact with the positive cases or any active symptoms. We have a checklist. If the patient does not have any kind of symptoms or any of the checklist criteria, we will allow him to follow the triage and followed by the casualty entry. If the patient has any kind of symptoms, for example, a high temperature patient, we will keep the patient, isolate the patient, and we will keep the patient aside, and we will check again for the to make sure the temperature is accurate, and we will collect the data for the checklist. If we feel like the patient is suspected, we will not allow the patient entry into the casualty. We will inform the doctor on call or the treating doctor we have in casualty that time, and the doctor will come out and will assess the patient, and we have a special request form to referral to Sabha COVID team. So we will send the patient directly to the Sabha medical casualty, and they have a special COVID unit with them, and we will follow us like that. If any cases especially from quarantines and directly for admission. We need really the patient need an admission. Any suspected cases or response to case or a positive cases, any kind of such scenarios. The ambulance, specialized ambulance, the COVID unit ambulance, they will carry the patient here outside the casualty. From the casualty, we will not enter the patient into the casualty area. We will directly admit into the specialized COVID unit. We have 44 and 45, 44 for the male and 45 for the female patient. And we will do all the other paperwork inside the casualty, and we will send directly to the respective wards. And we have a special COVID team headed by Dr. Hamad Abdullah, and he will assess the patient inside the ward, and as per the protocol, they will follow the admission procedure. That is all about the things. And if any patients we are feeling like wandering or suspected cases, we will isolate inside the casualty itself. We have an isolation room. We will keep the patient in isolation room, and we will inform the Dr. Hamad Abdullah, as he is head of our COVID unit, and as per him, the admission will be followed as in the normal or general wards, or to the specialized ward. But mainly for the wandering patients, we do not know where the patient is exposed or not, or the patient brought by the police from the street, or any kind of such scenarios. So we directly, without taking any risk, we directly admitting him to the COVID specialized wards. This is what we usually do with all precautions. Especially in casualty is such a highly risk area where we do not know how the patients comes with sometimes the patients are many patients comes with asymptomatic modes, so we do not know how the patient's behavior. Sometimes patient comes with aggression, so that time we are in a fully protected way. We wear the PPE all time, including mask, gown, all the available personal protective equipments. And the hospital administration already provided us with the scrub suits and all the supplies, including all the goggles which are necessary to protect ourselves from the thing. But even though some of our staff became positive, as we are in a highly risk place where we cannot control our the infection.
Good morning. I am Shalvin Abdul Karim, staff nurse working in Kuwait Center for Mental Health in Ward 39. I was the first one affected with COVID-19 in this ward. There was some patients who came here who have symptoms and checked by a rapid test. It was negative, and they have symptoms and they take antibiotics, but they become okay, and we thought that they are negative. But after some days, on May 5, I feel some symptoms. I am tired, I have body pain, I have no smell and no taste, and little fever also. So on the 7th, I went to Jabar and checked for COVID-19 PCR test. On 10th, they told me that you are positive and you should stay in home quarantine. I stayed in home for till 27. For the first exit swab, I came to our hospital and do the exit swab. I was again positive, but by new rule, I should enter the duty by 1st of July. After 3 days, I come to duty and I check. After I was confirmed with the positive, they do screening tests for all patients and staff nurse in our ward. Total of 17 staff nurse and 30 patient was affected. And some have little symptoms and some have no symptoms. And they converted our ward as a COVID positive isolation ward, and the staff are using precautions by using mask, total PPE. That is mask, gloves, gown, goggles, face shield, everything they are giving, and they are making precautions. And after 14 days, all patients become okay, and now we are safe. So stay safe.
I'm Sister Rifa, working in COVID ward 145 KCMH. Now I'll be explaining about the COVID protocols regarding positive cases and the suspected cases. So when we receive positive cases, first thing either we receive from direct admission, stat admission, or suspected cases also either stat admission or transfer from other wards. So first we will see about the positive cases. First we receive the cases from the main door, and we directly take the patient to the room where it is already set, and the staff will be in full PPE. And the patient once settled, we inform the COVID team according to the protocol. We inform COVID team Dr. Hamad, and next the COVID preventive Sister Indu, infection control team Sister Indu also. So after informing Dr. Hamad, we follow the protocol or COVID protocol orders. First thing, if the swab is already taken from the other ward, we wait for the result. If the result is already collected, if positive, we inform Dr. Hamad. If the swab is not taken, we take the swab from our ward and we wait for the result. And after receiving the result, if positive, we inform to Dr. Hamad. After informing Dr. Hamad, we wait for his orders and the following protocol. Normally the protocol will be like inform physician and follow the investigation, COVID protocol investigations consisting of CBC, full biochemistry, serum ferritin, D-dimer and ECG. ECG will be done every day and vital signs will be monitored very frequently. And after all this, if the patient is stable or if the vitals are unstable too, we inform physician. Physician sees the patient, and if the patient saturation comes down or if the fever goes high, according to the patient's condition, medicine will be prescribed. And normally if the patients are stable and with the medication, the patient will be getting okay. If the patient's condition is unstable, if the saturation is going down below 80 or 90, immediately we inform Dr. Hamad and physician. Normally the patients are seen by Dr. Bassam, and from our ward actually now 2 patients were transferred, one to Sabah and one to Al Rasi, and thank God patients are okay now. And so with the other patient, normal treatment will be going on. And after 14 days, according to the present COVID protocol, after 14 days, patients will be transferred to their respective wards. And this is in cases of positive cases. The other one suspected, we send swab for them. The swab comes negative, we transfer them.
أنا الممرض هاني عبد الجواد العباسي. المريض أحيانا بيجي لنا عن طريق الكاجواليتي، بيكون في أعراض، بيجي المريض هنا بنشيك عليه، نشيك على جسمه، نشيك على الفيتامين سايز بتاعته، الأعراض بتاعته بنسجلها، بنبلغها للطبيب دكتور حماد. طبعا دكتور حماد بنشوف اتعمل له سواب قبل كده ولا ما اتعملوش. لو جاي من الشارع بيتعمل له سواب، لو جاي من مستشفى آخر بيكون أحيانا معمول له سواب في المستشفى، وبالتالي ما يتعملوش سواب تاني إلا بعد 14 يوم. أما لو جاي من الشارع أو جاي من البيت ويتم دخوله على طول، فبيتعمل له سواب في المستشفى. بعد 14 يوم يتعمل له سواب تاني ونشوف النتيجة.
Good afternoon, I am Jinupi Varghese from Kuwait Center for Mental Health Ward 14. I am happy to say from the beginning of COVID-19 till today our ward free from COVID-19. We are strictly following the safety precautions which are given by our hospital management, and in our staff side we are using proper PPE from head cover, mask, goggles, face shield, gown, gloves, head cap in the patient procedure and the food time, preparing medication, and we are following the hand washing before and after the procedure and the proper use of hand rub. And we are strictly stop patient visitors and patient leave, and we are not allowing the outside food in our wards. And then in handover we are giving one-to-one handover from the group leader to group leader, and the staffs are maintaining the social distance between them, and we educate our patients about the coronavirus and the importance of this social distance and how to prevent from this virus. And from God protection and our head nurse help and support, we prevent this one. Thank you.
Good morning. My name is Sojiram Thomas from Ward 33. We have 2 COVID-19 cases in our ward. 1 patient and 1 staff nurse. First case reported on May 10th. Staff nurse. While he came for duty, he felt become chill and body ache. Suddenly sent to Sabha hospital for further management, and doctor sent the sample there, COVID. Result came positive. So, according to the preventive medicine policy, he quarantined for 14 days. Second case noticed on May 17th in our ward, 1 patient. While we are giving breakfast to the patient, he become dull and body ache, chillness like that. Suddenly we check the vitals, temperature more than 38. So we informed our on-call doctor. Doctor returned consultation to the physician. Physician seen and advised to transfer the patient to isolation ward and sent SAP. Then result came is positive. And also we are giving health information to the patient regarding COVID-19. Now in our ward, free from COVID-19. Stay safe. Thank you.
Good morning, everyone. My name is Sujit Hari Chandran. I'm a staff nurse in Ward 32. We are a male admission ward. We are free from COVID as of in May, but in the last week of May, we received a patient who showed no symptoms on admission, but on the next day of admission, he developed dry cough and temperature about 38.5. Immediately, we transferred the patient to Ward 44. Over there, his swab test was done and it turned out to be positive for COVID. In Ward 32, on admission, to ensure patient safety and the staff safety, we check vitals regularly, and if the patient shows febrile or if any active symptoms of COVID, we immediately transfer the patient to Ward 44 depending on the current policies and protocols. Within the staffs, we always wear PPE and maintain social distancing between the staff and the patients as well. And while doing certain procedures like bed making or while giving bath to the patients, we always use aprons, head caps, masks and gloves. We're going through a tough time right now, but with proper education and social distancing, I'm sure we can come over this COVID crisis soon enough. Stay positive, stay safe. Thank you.
Hi, good morning. I'm Jisha. I'm one of the staff nurse working in Kuwait Center for Mental Health. I'm working here admission ward, and we have 2 positive cases. Both are our staff nurses. Once initially one of the staff, she has been took the sample on May 7th and she's positive, and she's staying in the maternity hostel, and from there only they have taken the sample and they sent it for investigation, and it was positive. Then after that she was in quarantine in Al Sur, and now she's working after 28 days. But the report still not yet came. The second sample, third sample report not yet came, but still she's working. And our second staff, she has been sent sample from our hospital and it is also positive. Now she's been negative and the second sample is negative. She's also joined and she's also working here. As a staff nurse, we are all working here with the positive cases. Our ward, alhamdulillah, no patients, only the staff nurses too are positive. Thank you so much.
I'm Divya Pillai, nurse specialist cum acting head nurse of female admission ward 37 at Kuwait Center for Mental Health. In our ward, we confirmed 2 COVID-19 cases so far among our staff nurses. The first one was reported on 21st of May 2020 and around a week later we confirmed the second cases, that was on 27th of May. As soon as we received the result, we reported to our Director of Nursing, followed by Infection Control Department and Preventive Medicine Department, and as per their advice, the 2 staffs had been sent for 2 weeks of quarantine and we kept them monitoring closely. So after the cases confirmed, as a safety precautions to minimize the spread of infection, we re-instructed all the staff to wear full PPE and inside the ward and encouraged them for frequent hand washing. So after all this effort, we are free from COVID-19 cases from 7th of June and until now no more cases reported in our ward. Thank you and stay safe.
I'm Sister Amor, working in female ward geriatric psychiatric hospital. 2 of our staff became positive also after doing the swab in our respected hostels, informed that they are positive without any symptoms. Then they were quarantined in a proper quarantine area given by our Kuwait government for 14 days, came back to work after that. And for all, let us all be safe and protect each other and heal the world as one. Thank you.
Hello, good morning. This is Matthew Sebastian from Ward 40 KCMH Kuwait. I just wanted to explain the things regarding COVID-19. And in our ward, we have 2 cases of COVID-19 and it was 2 staff, not a patient. Anyway, the first case was reported on 4th of May and the second was on 18th May. Anyway, the staff shows some symptoms like body pain, headache, fever, like that. Then we just sent the staff to the Sabah. They examined and thereafter the swab, everything was collected from there and sent to preventive medicine. Then after 3 days the result came and it was positive. Till that the result came, they have been kept under isolation and under quarantine. He was staying alone and after that both were kept under home quarantine. After we know about this COVID-19, because the staff was already positive, we took some precautions inside the ward to protect the patient as well as the staff. We just disinfected the ward with Precept and all, and we are for the staff we are using PP and spacing. We are making grouping system for staff. And after completing these techniques, anyway, we are free from COVID-19 from the last of May 2020.
أنا staff register nurse عبد الله يحيى من جناح 41 من 21 الشهر 21/4 بدأ عندي علامات وأعراض زي وجع بالصدر، وجع بالجسم كامل، وجع أسفل الظهر، فقدان لحاسة الشمس، فقدان لحاسة الذوق وحرارة بالجسم. رحت على مستشفى جابر، عملت سواب بتاريخ 23/4 في 25 طلعت النتيجة، خبرونا النتيجة كانت بوزيتيف، فحكوا لازم فقعدت في البيت كورنتين لحتى اجى الامبولانس. دخلت مستشفى جابر لمدة 26 يوم. خلال هاي الفترة كانوا طبعا تشيك على الصور للصدر الأسبوعية، فحوصات الدم كانت متواصلة، طبعا اطمئنان على الصحة، علاجات. عملت عدة سوابات. لقيت سواب هي كانت ب21/5 كانت نيجاتيف والحمد لله. خرجنا من المستشفى على البيت والأمور كانت الحمد لله سليمة. حاليا رجعت على الدوام والحمد لله ما عندنا أي حالة بوزيتيف بالجناح والأمور مستقرة جدا. وحاليا نحن نتبع طبعا وسائل الوقاية كاملة بالجناح، من ماسك، من جلافز، من بعد مسافات، طبعا استخدام الكحول، تنظيف الأيدي، لازم برضه الهاند ووش بين كل مريض. التعامل مع أي مريض مع أي إجراء أي بروسيجر لازم نغسل ايدينا بين كل بروسيجر وبروسيجر. وحاليا الحمد لله الجناح تمام.
ممرض محمد عبد الحق السيد، أعمل في جناح 43 أدميشن بمستشفى مركز الكويت للصحة النفسية.
My name is Matthews John. I'm working as a staff nurse in psychiatric hospital in Ward 43.
أنا يوم 22/5 حسيت بأعراض صداع وارتفاع بالحرارة وبدأ معايا إسهال، فبلغت المسؤول عن الصحة الوقائية هنا بالمستشفى وخدوا لي مسحة. المسحة النتيجة طلعت في نفس اليوم وبلغوني بيها إن أنا المسحة بتاعتي إيجابي، وقعدت 10 أيام حجر منزلي وداومت بعد 10 أيام والحمد لله الأمور يعني اتحسنت معايا بسرعة الحمد لله. وداومنا بالجناح وبدأنا ناخد احتياطاتنا في الجناح. هي طبعا من قبل كده احنا بادئين فيها، انما بدأنا دلوقتي يعني زيادة كمان معانا ومع المرضى ومع الاستاف في التباعد. بنلبس الحاجات الماسك والجوي وكل الاحتياطات في التباعد بيننا وبين الاستاف وبين المرضى. وان شاء الله يعني بنحافظ على الجناح هنا ان شاء الله ما تجيلناش اصابات لا فينا وفي الاستاف او في المرضى.
I am licensed C. Joseph, working in Ward 8 as a staff nurse in Kuwait Center for Mental Health. We have 2 staff. By God's grace, all patients are safe without this COVID-19. But 2 staff got infected. While they got infected, they already gone for home quarantine. So there is no chance for our patient to get infected from them. And also, every staff maintain social distancing while going for food or while going for tea or drinks and while taking care of patient. And for patient also we are maintaining as much as possible social distancing.
I myself Philip John. I am working in Manara 2 male pediatric side. About the COVID-19, that from the starting of this problem, we don't have, and still now we don't have any positive cases inside the ward. It's only because we are just following the rules which are provided by our hospital management. First of all, we are doing the social distancing inside the ward. We are very properly maintaining the social distancing even while giving handover also. We staffs, we are not being in a group. We will not sit as a group, and even in the handover time, we are just giving handover by head nurse to the next shift leader, so that the staff nurses are not coming as a group. And moreover, the rules which is provided by the hospital management, like we have to use the gloves and mask, and we are strictly following that. And moreover, we are from the starting, we are not allowing any visitors inside the ward to avoid the contact with the positive cases. And moreover, we have kept one sanitizer outside, so that those who are coming each and every time, those who are entering inside the ward, they have to clean their hand with the sanitizer. Thank you.
بالأصالة عن نفسي وبالنيابة عن زملائي أتوجه بجزيل الشكر للسيدة الفاضلة مترون هند، وذلك لدعمها لنا كفريق لتوثيق المجهود المبذول في فترة جائحة كورونا كوفيد-19. والشكر موصول لكل مسؤولين الأجنحة لظهور هذا المجهود المبذول داخل الأجنحة لتوثيقه ونجاحه خلال هذه الفترة. وقد نبعت هذه الفكرة من الزميلة مريم عباس بالتعاون مع الفريق، وهو السيدة مساعدة الرئيسة مترو الغدير وزميلكم أحمد نوار لتنفيذ هذا العمل. وكما تعودنا من تمريض مركز الكويت للصحة النفسية عند الصعاب شدائد، بالإضافة إلى المجهود الجبار الذي بذل لتوفير الفيس شيلد في فترة الجائحة، وقد كانت مترو هند رائدة عمل الفيس شيلد، وقد تم تشكيل فريق لهذا العمل بأيدي أبنائها داخل المركز وهم نفس فريق التوثيق. وقد تم عمل أكثر من 1200 حبة تم توزيعها على جميع الأجنحة، بخلاف التبرع الخارجي للفيس شيلد. وختاما أشكر جميع الزملاء جزيل الشكر على مساعدتهم لنا في هذا العمل لظهوره ونجاحه. شكرا.
you